Hi, everyone. I think people are still joining, but for the sake of time, I'll go and get started. And then we'll have a brief introduction. So when people are joining, we'll start on the webinar. First of all, welcome to ATSDR Public Health Assessment Training. Today is a part 2 of the 7. So thank you all for being here, especially, thank you all for being able to get to the new time, and we apologize for moving the event 30 minutes earlier due to a CDC all hands at 1 o'clock. So hopefully this has not been created too big a hurdle for all of you. So you're here, so that's good. We get the news across. This training series is organized by ATSDR Office of Community Health and Hazard Assessment, or OCHA. My name is Jen Lee. I'm OCHA's Associate Director for Science. Here, before we start, we have a couple of housekeeping items. First, as you probably have gathered in, this webinar is recorded, and we plan to release a recording to the public. So all the audience are muted during the presentation. If you have any questions, please feel free to type them in the chat box throughout the whole presentation. At the end, our presenter and panelists will answer all the questions received in the chat box. And after that, if we still have time, we will also enable live question and answer. We'll tell you, just feel free to raise your hand. We can unmute you, you can unmute yourself and then ask question on the spot. So let's get to it. As you know, ATSDR and the state partner conducts public health assessment to investigate exposure, evaluate potential health effects, and develop public health actions to protect communities. We're constantly developing and updating guidance to reflect the best science and improve our work. So today, our webinar, during today's part 2 of the 7 series, we have 3 presenters and panelists to present our newest guidance, exposure point concentration guidance for non-discrete sampling. So I'll hand off virtual microphone to each of them for self-introduction. So first up, Dr. Greg Ulich from our OCHA ADS office. Greg?
Yes, thank you, Jane. And good afternoon, and welcome to the second webinar in ATSDR's 2022 Health Assessment Training Series. As Jane mentioned, I am Greg Ulich, and along with Jim Durant, we will be introducing the agency's new exposure point concentration guidance for non-discrete sampling. I am an environmental health scientist and have been with ATSDR for about 35 years. Over this time, I have been a health assessor, a technical project officer, and I'm now Associate Director of Science in the Office of Community Health and Hazard Assessment within OCHA. Jim, would you like to introduce yourself?
Yeah, hi everyone. I'm Jim Durant. I'm a certified industrial hygienist. I've been with the agency for over 20 years. I've done a variety of things with ATSDR. I've been a health assessor. I've been an emergency response coordinator. I have been lately working, well, really for the past 7-8 years, working in the exposure investigation section on exposure investigations and statistical analysis of environmental data. And I think we've got Rebecca DeVries with ERG.
Great, thank you, Jim. My name is Rebecca DeVries, and I'm a health scientist at Eastern Research Group, or ERG. I've been working with ATSDR, providing contractor support on several guidance documents for a few years now, including the one we're discussing today. I'll be on the line as a panelist to help answer any questions that come up along the way. So thank you, and back over to you, Greg.
Yes, thank you, Rebecca. So for today's webinar, we will begin with an introduction of ATSDR's exposure point concentration, or EPC, guidance for non-discrete sampling, and a description for how this fits in with other existing guidance documents and tools. We will then provide some background information on EPCs, followed by a discussion on the differences between discrete and non-discrete sampling methods. After that, we will step through ATSDR's recommended approach for reviewing and estimating EPCs with non-discrete sampling data. First, for incremental sampling methodology, or ISM data, and then for composite sampling data. These are the 2 types of non-discrete sampling methods covered in this new guidance. We will begin with an overview of ATSDR's guidance for conducting public health assessments, or PHAs. As you all know, health assessors perform various activities during the public health assessment process, such as developing site conceptual models, screening environmental data against health-based comparison values, identifying exposure units, and calculating EPCs and doses. To help with PHA activities, ATSDR has developed various guidance documents. One example is the Public Health Assessment Manual, which steps through the entire PHA process. This manual was recently updated from the 2005 paper version to a web-based interactive design, which was launched earlier this month, actually last week, and will be presented next month during the May 11th webinar in this series. Another example is the various exposure dose guidance, or EDG, documents that have been developed to supplement the Public Health Assessment Guidance Manual. These documents describe key considerations for specific steps in the PHA process. ATSDR has also developed various tools. One is the Public Health Assessment Site Tool, or FAST, which can be used to screen environmental data and calculate doses to evaluate cancer risk and non-cancer hazard. Another example is ATSDR's new EPC tool, which is a web-based application for calculating exposure point concentrations, or EPCs. This tool will be launched in May, next month, and will be featured in a June 15th this year webinar in this series. Some of the exposure dose guidance documents developed over the past 3 years are specific to calculating EPCs. There is different guidance depending on the type of sample collected and the specific chemical class. 2019, ATSDR released EPC guidance for discrete sampling, as well as guidance on how to calculate toxic equivalents when working with environmental samples analyzed for dioxins and dioxin-like compounds. In 2022, ATSDR released guidance for a different class of chemicals, polycyclic aromatic hydrocarbons, or PAHs, as well as the EPC guidance for non-discrete sampling, which is the focus of our webinar today. It's important to note that both of these documents can be found in the new resources page of the Web FAGM, or the Web Public Health Assessment Guidance Manual. Before we dive into the new guidance, let's take a step back and refresh with some general background information on EPCs. To begin, EPCs are defined as contaminant concentrations that best represent what receptors are or could be potentially exposed to. EPC concentrations apply to all environmental mediums, including air, water, soil, sediment, or biota. EPCs are typically informed by environmental sampling results. They can be based on modeled results, but for the purposes of this webinar, we are going to focus entirely on measured data. In practice, EPCs serve as a reasonable, health protective estimate of the contaminant levels in an environmental media that individuals may be exposed to. EPCs use calculated doses, are used for calculating doses, estimating non-cancer hazard quotients, and cancer risk. So what statistics are used for EPCs? ATSDR recommends different statistics for EPCs depending on the way the samples were collected, discrete versus non-discrete sampling approaches, and the characteristics of the data set being evaluated, which includes sampling size, frequency of detected observations, and this distribution of the results. For EPCs with discrete sampling data, ATSDR recommends maximum concentrations, or 95 UCL, the upper confidence limit of the arithmetic mean. This is covered in detail in the EPC guidance for discrete sampling. For non-discrete sampling, ATSDR recommends arithmetic means and weighted means. We will discuss when to use each of these statistics later in this webinar. The guidance we are presenting today outlines how to estimate EPCs for environmental data generated by non-discrete sampling methods. A non-discrete environmental sample is generated when multiple samples are collected in the field and combined into a single sample for laboratory analysis. This is quite different than a discrete sample, which is an individual environmental sample collected at a given point in time, independent of other samples. Multiple discrete samples are often collected in the field, but laboratory analyses are run separately on each one. The new guidance on non-discrete sampling specifically covers ATSDR's preferred approach for estimating EPCs for incremental sampling methodology, or ISM, or other composite sampling data. Before we step through this guidance and those two sampling strategies, let's talk a bit more about discrete versus non-discrete sampling. And we'll begin with discrete sampling. For many years, environmental investigations have relied on discrete sampling practices. The figure on this slide provides an example of a discrete sampling plan. This image shows 9 individual surface soil sampling locations, which are labeled A through G, with arrows pointing from each sampling point to a unique sample jar, also labeled A through G. Soil from each location is analyzed separately as an independent sample in the lab. These types of discrete sampling methods can provide useful information to support site delineation and identify hotspots. However, they fall short sometimes when it comes to providing accurate and reproducible data needed to confidently estimate average exposures, or EPCs, across a given area. This is largely due to errors that arise because of the heterogeneous nature of environmental media such as soil. Sticking with soil, let's dig deeper into the concept of heterogeneity and how it affects sampling results. There are 2 types of heterogeneity to consider for soil. Each type results in different errors. The first is called compositional heterogeneity, which refers to the variability in the physical properties and chemical composition between individual soil particles. The idea here is that particles are of varying sizes, shapes, and types, not evenly distributed throughout a given volume of soil. This results in something called fundamental sampling error, which is illustrated in the figure on the left side of the slide. In the figure, there is a square box showing particles in a given volume of soil with larger dots representing contamination. The 2 jars underneath, each drawn from a different area within the volume of soil, show the variability in contamination captured by the 2 discrete samples. The jar on the left has no dark dots and therefore did not capture the contamination. The jar on the right, however, did capture some of the contamination. Fundamental sampling error is called fundamental because it is an error that will remain even after other sources of error have been removed. It is unavoidable, though larger sample masses will have lower fundamental sampling error than small sample masses. The second is called distributional heterogeneity, which refers to the spatial variability of soil particles and contaminant distribution across an area or within a volume of soil. Distributional heterogeneity is caused by the uneven, non-random distribution of contaminated particles within the soil. Distributional heterogeneity causes grouping and segregation errors. In grouping error, different areas of the exposure unit might have more contamination than others, leading to some discrete samples with high concentrations of the contaminant and others with very low concentrations. You can see this on the middle box of the figure on the slide under grouping error, where the 2 discrete samples drawn from different areas result in different concentrations of the contaminant because of the way the contaminant is grouped. Segregation error can happen when there is a stratification of soil components. In the figure on the right side of the slide, you'll see that there is some contamination shown by the darker spots at the bottom of the volume of soil. In this scenario, gravity may have caused the contaminants to move below other soil components. So sampling at different depths would lead to different contaminant concentration results. These types of errors can be managed by collecting a sufficient number of sample increments and using specific subsampling and processing methods in the lab. Non-discrete samples were developed to address some of the shortcomings and errors associated with discrete sampling, the ones that we just discussed on the previous slide. These methods minimize sampling errors associated with compositional and distributional heterogeneity. Because of this, they provide greater reliability and representativeness compared to discrete samples in many scenarios. ATSDR's guidance covers 2 common types of non-discrete sampling: incremental sampling methodology, or ISM, as I've mentioned, and composite sampling. These two approaches rely on similar collection methods, but provide considerably different information about contaminant concentrations in an exposure unit, and we'll talk about both today. So now for the discussion of the first sampling methodology for non-discrete sampling, ISM, I'll turn it over to Jim Durant. Jim?
Okay, thanks, Greg. So let's begin with the guidance recommendations for ISM data. The goal of the ISM data is to obtain and analyze a sample that contains analytes in the same proportion as the exposure unit and volume of soil being evaluated. The statistical basis for this method is attributed to Pierre G., who pioneered the concept through addressing the variable distribution of minerals within rock formations. Through his work, he identified various sampling errors that arise from this heterogeneity and then developed ways to minimize those errors in a sampling design stage, rather than after the fact with statistical methods as we would do with discrete sampling. ISM protocols stemming from G's work are specifically designed to minimize sampling errors. Rigorous planning is used to ensure that ISM samples yield unbiased estimates of average concentrations across an area of interest, often referred to as a decision unit. As a note for ISM sampling, a decision unit is the term used for the smallest volume of soil which a decision will be made, which may or may not line up with an exposure unit in a PHA. Many discrete samples, often called increments, are collected systematically across that area and are combined into a single sample for analysis. Specific subsampling and processing protocols are followed in the lab to further control for heterogeneity and ensure representative data. ISM methods are currently mostly applied to soil. Beginning with planning. Sample design is a key component of ISM. Whenever possible, health assessors should participate in the planning process to ensure that the data collected will be usable in their PHA. They can provide valuable information for designating exposure units, developing data quality objectives, or DQOs, and developing how samples should be collected and analyzed to meet those objectives. Regardless of their involvement in the planning, health assessors should always review sampling and analysis plans, or SAPs, to be sure that the data are appropriate for the PHA. So moving on to data collection, ISM soil samples are prepared by collecting many equal mass increments across a defined area in a systematic way, and then physically combining those increments into a single sample for analysis. A minimum of 50 increments is recommended, though oftentimes between 80 and 100 increments are collected, especially if there is expected to be great variability in concentrations across the area being sampled. Other guidance has recommended a lower minimum of at least 30 increments. However, when fewer increments are collected, it's more likely that the samples will not accurately characterize average exposure. For example, 30 increments collected over an acre property with several small areas of elevated contamination may not capture average exposures. Additional increments up to possibly 75 or 100 may be needed in this scenario, as well as for specific contaminants that are more likely to be present in their pure state soil. Additional ISM field samples or replicates are collected concurrently to provide insight on the uncertainty and precision. Sometimes these are collected at all decision or exposure units, with other times they are collected in a subset of exposure or decision units, say like 10%. Many different ISM sampling designs exist. The diagram on the slide shows a systematic random sampling design with one parent sample and two field replicates. This figure shows a square with a 6x6 grid laid over it, which divides the area into 36 grid cells. Under this type of sampling design, the sampler would systematically collect equal mass soil increments or mini samples at a consistent depth from the top left-hand corner of each cell, shown in this image as all the A sampling locations. Those 36 increments would then be combined into a single sample container A for shipment to the lab. The sampler would then complete this process, collecting 36 increments at the B locations and then at the C locations. Those increments would generate 2 additional ISM samples for the lab, which in this case would be considered field replicates. Additional procedures to reduce sampling errors are required in the laboratory analysis phase of the ISM process. First, the lab dries, sieves, or grinds the samples as necessary according to the soil and contaminant types. Then the lab collects an aliquot from each ISM field sample and spreads that volume of soil out in a pan to subsample again, following the same procedures as in the field, but at a much more smaller scale. For select ISM field samples, the laboratory will also collect replicates during the subsampling process. The image on this slide shows 3 ISM field sample replicate jars for parent field sample A and field sample replicates B and C, with arrows pointing down to the laboratory subsampling grids for each. One of those samples, field sample replicate C, is further processed into multiple lab replicates during the subsampling process. So how do we use these data? Before using ISM data to calculate EPCs, you need to carefully review all the available information to make sure the data are of good quality and applicable for your PHA. Ask yourself if the stated objectives for the sampling program are consistent with the PHA. If the data quality objectives or DQOs are incompatible with the PHA objectives, the data can be used ask yourself if the stated objectives of the sampling program are consistent with the PHA. If the data quality objectives or DQOs are compatible with the PHA objectives, the data can be used for the PHA. Some examples of questions you might ask are the boundaries of the sample collection consistent with the exposure units? If they aren't, the data from the ISM may not be representative of the exposure unit. Is the sample depth collection consistent with the ATSDR's preferred soil sampling depth? Typically, this is the top few inches of soil that are preferred because that is what people are more typically exposed to. If DQOs are specified, were they met? If not, or those DQOs are not in line with the needs of the PHA, it may be appropriate. It may not be appropriate to use the data. The next step is to review the field sampling protocols. For discrete sampling, we use statistics to try to characterize the uncertainties that arise from fundamental sampling error and grouping and segregation errors. But with ISM, these uncertainties are minimized through the sampling process. Because of this, it is important to take a close look at the sampling protocols to see if the errors were in fact adequately minimized. Check for the following elements in the field sampling protocol. Were enough increment samples collected, ideally 50 or more? Was each increment sample of equal size and mass? Were increment samples collected at a consistent depth in an unbiased manner? Was the total mass of the sample appropriate? This is typically from 1 to 2 kilograms. Were enough ISM field replicates collected to provide insight on precision of the sampling and analysis methods? The next step is to review the laboratory processing protocols. At this stage, the sample received by the lab is still subject to the grouping and segregation errors discussed earlier. The techniques used for processing the samples in the lab help control these sources of error. Check for the following elements in the lab processing protocols. Were the samples air dried to facilitate disaggregation? Were samples sieved to exclude larger particles? Were the samples ground up or milled to reduce particle size if appropriate? Were representative subsamples collected in the lab? Some of these procedures will change for different contaminants. For example, air drying, especially at higher temperatures, can cause loss of volatile contaminants from the sample. The final check is to review the results of the laboratory analysis. To start, make sure the results are complete. Were the results provided for all samples and analytes requested? Were quality assurance and quality control milestones met? Finally, if triplicate results are available, which would be one parent field sample and 2 field replicates, you can calculate the relative standard deviation to get an idea of the precision of the results. The RSD is calculated by dividing the standard deviation of the ISM replicates by the mean of the ISM replicates. We'll go over the interpretation of the RSDs later in this presentation. Once you've reviewed your data and determined that it's acceptable for use in the PHA, how do you estimate the EPC? ATSDR recommends using the arithmetic mean of the ISM results as the EPC if sample correctness and representativeness have been confirmed following the review process we just stepped through. The exact procedures vary on the number of replicates available in each data set. Of note, these procedures are applicable to evaluating environmental data for intermediate and chronic exposures. Only in some cases are our ISM data appropriate for evaluating acute exposures. Usually this is when ISM sampling protocol is specifically designed to assess an acute exposure. However, I will discuss a few other cases later in this presentation. If only data from a single ISM sample are available and you have determined the data are of good enough quality and representative of the exposure unit based on all available information, you can use the result from a single ISM sample as an EPC. However, you should note the limitations associated with a single sample in the PHA. ATSDR's guidance provides suggested language for this as shown in the green box on the screen, which reads, EPCs are based on a single ISM sample. Although the sample appears to have been properly collected, processed, and tested consistent with the general principles of the theory of sampling, field triplicates were not collected, and therefore we cannot confirm that the sampling program has achieved the designated precision at each decision unit. If only a parent ISM field sample and 1 field replicate are available, these would be called duplicates, and you have determined the data are of good enough quality and representative of the exposure unit based on the available information, use the average of the primary ISM sample and the field replicate as the EPC. As on the previous slide, suggested language for acknowledging the potential limitations of the data is shown in the green box here. And it reads, EPCs are based on 1 ISM field sample and 1 replicate. Although the sample appears to have been properly collected, processed, and tested consistent with the general principles of theory of sampling, field triplicates were not collected, and therefore we cannot confirm that the sampling program has achieved the designated precision at each decision unit. For triplicates, when you have 1 primary and 2 field ISM samples, use the average of the primary sample and the 2 field replicates as the EPC. In this case, you have enough data to calculate an RSD. An RSD of greater than 0.5 suggests a potential problem or error with the data. When this occurs, you should reevaluate if the data should be used at the PHA at all. Again, keep in mind that the RSDs should not be used as the sole indicator of data quality. A 0.5 RSD should be thought of as a guideline rather than a rule. There are some cases where high RSDs are unavoidable, for instance, when the concentrations approach laboratory detection limits. In these cases, it may be useful to consider interpreting the RSDs in context with available health comparison values. For example, if the ISM results are far below the CVs, it might not be as much of a problem or as concern if the RSD is greater than 0.5. Before we move on to composite sampling, I would like to just touch on briefly about acute exposures. As we mentioned earlier, ATSDR generally does not recommend using ISM data to evaluate acute exposures unless the area where the sample increments were collected represent where an acute exposure might occur. In other cases, you may be able to use professional judgment to determine whether ISM data can be used. For this, you might consider the variability of the contamination and the way people move within the exposure unit. For example, it might be appropriate to evaluate acute exposures with ISM data if contamination is not expected to be highly variable, or people are not expected to spend more time in any one particular area of the exposure unit. In other cases, he might determine that the data are not appropriate for evaluating acute exposure. Ideally, in these cases, the exposure unit would be redefined and ISM would be applied to smaller, more relevant data or more relevant areas to define acute exposure. And Greg, I think it's time to transition over to composite sampling.
Yes, thank you, Jim. And yes, let's transition to guidance recommendations for reviewing and calculating EPCs from composite sample data. We provided an overview of composite sampling at the beginning of this webinar, but to reiterate, composite sampling is when multiple discrete or grab samples are collected and then combined into a single sample for laboratory analysis. For soil, this could be done by gridding off a defined area and then collecting several grab samples of equal volume from the same depth within each area of that grid. Grab samples from each grid would then be combined, mixed, and then an aliquot of that mixture would be collected for analysis. The figure on the slide depicts this process. In this figure, there are 5 grab samples represented by 5 small jars, each labeled A. Those would then be combined into the larger jar, also labeled A. And then an aliquot would be taken from that larger sample jar to be analyzed by the lab. Composite samplings can represent average concentrations over an area and volume of material from which the grab samples are collected. Composite sampling is less structured than ISM. It requires collecting far fewer sample increments than ISM, and it doesn't involve the same rigorous subsampling and processing by the lab as ISM. Because of that, it tends to offer less control for some of those sampling errors that we discussed earlier in the presentation. Given these limitations, composite sampling is most appropriate when there is known or expected to be low variability in contaminant concentrations across an exposure unit. The review process for composite sampling is similar to ISM, so we will talk through this quickly. First, you should review the sampling and analysis plan and the data quality objectives to evaluate the appropriateness of your data for your PHA. Remember that the area sampled should have the same boundaries as the exposure unit being evaluated. If the DQOs are not available, the sampling report might have a statement of purpose from which you can read instead, or review instead. Then you should confirm that the sampling plan justifies the number of grab samples collected per composite. For example, small number of grab samples may indicate that the data are not appropriate for estimating EPCs, especially when the contaminant is not assumed to be evenly distributed throughout the exposure unit. Finally, you want to review the field and laboratory reports to ensure appropriate mixing and processing of the composite sampling. Remember that mixing can introduce segregation error for certain soil and contaminant compositions, so you should be sure to check that the appropriate methods were used for the specific material sampled. Once you've determined that the data are appropriate for use in the PHA, the way the EPC is estimated depends on how many composite samples were analyzed for a given exposure unit. With a single composite sample, the results from the sample may be used as your EPC. You can see that on the slide where we are showing a single composite sample labeled A, which is made of 9 evenly spaced grabs from within the defined exposure unit. However, you should be carefully reviewing the underlying information to determine how confident you are that the composite sample represents average exposures within the exposure unit. Limitations should be noted in your PHA with language such as that shown in the box, reading, sampling data were limited and ATSTR is applying some level of professional judgment in evaluating the data. To illustrate EPC estimation with a single composite sample, let's imagine a residential development built on former agricultural land where pesticides were applied by an aircraft. You are asked to estimate the EPC of a specific pesticide. For the purposes of this example, let's assume that each property is an exposure unit. Because of the methods of the pesticide application, let's also assume that the contamination levels are homogeneous across the properties. The sampling plan indicates that 5 surface soil samples were collected at one property and combined into a single composite sample. The lab reported a concentration of 5.5 milligrams per kilogram for the pesticide of interest within the composite. Here, because there is only one composite sample, which appears to be representative of the exposure unit, we can use the 5.5 milligrams per kilogram as the EPC for that property. However, we would need to acknowledge the uncertainties with this value in the PHA. As another example, imagine a residential development built on former agricultural lands where a resident found empty pesticide containers buried in topsoil on the property. The lab reported a concentration of 5.5 milligrams per kilogram for the pesticide from 5 grab samples of surface soil collected from a single property. In this case, you might be concerned about hotspots because the presence of buried pesticide containers suggests that the pesticide is not evenly distributed across the property. You might also be concerned that the pesticide sample does not capture areas with high concentrations. Generally, a larger number of increments or grab samples would increase the possibility of a hot spot being captured. In this scenario, you might determine the results do not adequately characterize average concentrations and recommend additional sampling. As far as how to estimate EPCs with multiple composite samples collected in an exposure unit, you first need to determine whether the composite samples represent equal areas, size areas of the exposure unit. For composites representing unequal size areas, ATSDR recommends using a weighted mean as the EPC, with weights equal to the percentage of the exposure unit represented by each composite sample. The figure on the slide shows an example of this. The figure shows 3 areas with a single exposure unit labeled A, B, and C. In each area, 5 grab samples are collected and combined into a composite. The 5 samples contributing to composite sample A were collected from an area that appears to represent about half of the total exposure unit. Composite B represents about 30%, with composite C representing 20%. These percentages would then be used to calculating a weighted mean of the results for the 3 composite samples. This would be done by taking the area for the results for area A, multiplying it by 0.5, then adding the result of the mirror area B multiplied by 0.3, and then finally adding it to the result for area C multiplied by 0.2. The composites representing equal size areas, the arithmetic mean of the composite sample results would be used as the EPC, which is a much simpler calculation. Before wrapping up our presentation on composite samples, there are a few other points to consider. The first is related to acute exposures. Like ISM, ATSDR generally does not recommend using composite sampling data to evaluate acute exposures unless the sampling protocols were specifically designed with the goals of characterizing acute exposures. The second is related to biota. Up to this point, most of our presentation has focused on soil, and that is because ISM methods have really only been developed for that medium. Composite sampling, however, is often used for other environmental media, such as biota. ATSDR's guidance also outlines some important considerations when working with biota composite samples. Some of those are listed here, such as a composite sample should consist of at least 5 specimens of the same species. Specimens should be approximately the same size. Samples should only consist of the edible portion of the biota. A minimum of 3 composite samples should be collected for each species. And EPCs for one species should not be extrapolated to another. These guidelines help ensure that the sample is representative of human health exposures. So in closing, today we summarize non-discrete sampling methods, which involve collecting multiple samples and combining them into a single sample for laboratory analysis. These methods are designed to minimize errors and, when implemented correctly, can be used to characterize the overall or average contamination in the area of interest. ATSDR has developed guidance for reviewing and estimating EPCs with these methods. This involves carefully reviewing the data and any related documentation, calculating appropriate EPCs, either aromatic means or weighted means, and noting the limitations of the EPCs in the PHA, especially in the case of a single ISM or single composite sample. And finally, we encourage you to read the EPC guidance for non-discrete sampling, which discusses these topics in far greater detail than we could cover in this 1 hour webinar. And with that, we thank you for attending and this webinar, and we are happy to answer any questions that you might have. Jane?
Yeah, thank you, Greg and Jim. Great presentation. So we received some really good questions in the chat box. First of all, before we get to the presentation, I did put the link to the full guidance in the chat box. So it's online, feel free to get it. All the contents are coming out of the guidance. So now let's get to the questions. I think the first two are connected, same question, from Carl and Paul. If you have a major outlier, for example, median or geometric mean at about 300 ppb with one sample at 63,000 ppb, will this be, how would you estimate a EPC? I assume that's what you're asking. And then Paul followed up that many, if not most, environmental samples are not necessarily normally distributed. The use of arithmetic mean is most appropriate for normal distribution. So Jim, you want to take this one up?
Yeah, sure. Trying to think about the best way to formulate this, because there's actually a lot of moving parts here to talk about. You know, one of the things that we try to do with incremental sampling design is to try to focus in on collecting enough mass to overcome some of the variability that leads to kind of these wild discrepancies in analytical results. So, I mean, the figures in the slides do, I think, a very good job and justice showing what's going on with some of the sampling errors that can occur. But one thing that was helpful to me, let me bring it up here. So I worked with the U.S. Geological Survey with a lead poisoning outbreak investigation back in the early 2010s. And I collected a number of different soil samples, and they were analyzed by the U.S. Geological Survey in Denver, Colorado. This was a huge lead poisoning outbreak. We had blood lead levels, like the average in one village was like 130 micrograms per deciliter. So to give you an idea of how bad the event was. So we had real mortality going on. So some of the soil samples we were looking at, the USGS looked at with backscatter electron microscopy. And you can see here in red, the more lead contaminated particulates from the three media that we looked at. One of these was the ore that was being processed. Another was dust collected in a home, and another collected in as an incremental sample that I did over the entire village. And you can see like the lead is sort of concentrated in some of these particles, and depending on the sizes and the amount of lead contamination that's inside each of these particles, having an individual particle fall into or out of your analytical sample can make a huge amount of variability in terms of what your analytical result is. So the idea behind incremental sampling designs is that you're trying to get enough mass of sample to where you've got sort of a census of all these different types of particles that could be out there, and then analyze that, process that, and reduce that to a level that you can analyze that with a laboratory machine and get that true average. If you don't collect enough mass, what happens is, one of these, imagine just grabbing one small area of the sample, right? You'll miss this really large particle. Well, next sample right next to it, you'll end up having that particle fall in, and that'll make a huge difference in your sample. And it's not just the contaminated particles that lead to this sort of skew thing going on. the mass of the uncontaminated particles makes a difference as well. So, it's your concentrations are always a ratio of your contamination to your total mass. So if your total mass is affected by, some particles falling into or out of your sample, and you have a very, very small amount that you're looking at, you can see very quickly, like one of these large uncontaminated particles falling into or out of an analytical subsample could make a huge difference in your concentration. Now, this is a very, sort of a best case scenario for that kind of problem, because the lead contamination here was literally in the percent levels in this community. But typically we're worried about 400 parts per million or less sometimes. So you can imagine 1/10 of the amount of contamination, what the problem would be. You'll have a bunch of non-detects, and all of a sudden, like boom, you'll have a very hot sample with a high level if you go at it without a sufficient sample mass there. Did that answer the question?
I think just a follow up. I think this is a great illustration on sampling strategy and taking samples. But I think for many of the health assessor, when you get the data, you're not necessarily involved in the sampling process. So in the case that Carl is talking about, for example, you get this data set and you have the geomean and the median at, at a certain 200 ppb, but all of a sudden you do have some of the individual sample at 1,000 times higher. Do you follow the guidance of doing EPC calculation? You take an arithmetic mean to calculate EPC in this kind of sample. I mean, how would you handle? I believe that's where Carl comes from.
Yeah, so I mean, if it's discrete sampling, there's kind of a catch for that sort of scenario where there's a lot of variability in your estimate of the EPC. And typically it's like a 3-fold or 5-fold factor in the UCL compared to the mean. And that's one sort of quantitative way of looking at the data and saying it's a problem. But what you've got there though is definitely a lot of variability. And if it's discrete samples and you're getting that kind of variability, that tends to make me think that maybe you don't have good representative data in that case. And that's, like you say, we sometimes get data like that, and there's no magic pill or SAS proc or R package that can fix data that are not representative. And particularly with ISM sampling, really want to try to get involved early in the process because you can spend a lot of time, or somebody can spend a lot of time and resources and generate data that are not useful for a PHA with ISM sampling particularly. Greg, what do you think?
Yeah, no, I have nothing to add. I agree with you.
Yeah, and I think Carl just made a comment saying that outlier fast wouldn't estimate.
Yeah, it's a really common phenomenon with data that are collected, particularly with discrete sampling techniques that don't get the required mass that they need to really be representative. And that's one reason why I'm personally partial to soil sampling with ISM, because it does help with sort of that phenomenon.
Okay, since you talk about ISM sampling mass, I'm going to just jump to the question that just came in from Andrew. For ISM sampling, what mass of aliquot does ATSR recommend for extraction and analysis for each replica?
Right, so that's going to vary depending on the concentration of the contaminant that you're looking at, the amount of, how concentrated the contaminant could be in individual particulates. Like here, this is, obviously a very good illustration of very concentrated particulates. And it's going to depend on the sort of the size of the particulates. So smaller diameter particles are much more easier to sample representatively, because you've got many more particles per volume mass material that you've got there. So one of the things that's done in ISM sampling is there's a milling and grinding step in many of these samples, and that helps reduce the fundamental error and allow for smaller sample volumes to be used in the laboratory. Sometimes there's a limit in terms of what can be extracted in a laboratory. So you have to kind of adjust your methodology depending on what level of contamination you're looking for, and what the laboratory can do, and what can be done to process the sample in the laboratory.
Okay, thanks, Jim. So the next question is a long one. It's in the chat box. You guys can also read it, but I will read it out since we're recording. I think this question probably Greg can take it. The question is from Arthur. In a geographic area with 10 equally sized properties, there's concern for soil contamination. There are no physical boundaries of the properties. People move across all of the properties. The owners were asked if sampling could occur. 3 of the 10 gave permission for sampling and the other refused, effectively a convenient sample. ISM sampling was done on this 3 property only, yielding soil concentration of 500, 1500, and 2500 ppm, each representing 1 property. What can be said, if anything, about soil concentration across all properties? Oh, that's a tough one. Greg, you want to try it first?
Sure. Yeah, well, right off the bat, I mean, you have three of the samples. Looks like there is about a 5 times difference between the bottom and the top. That could be some inclination that there may be lots of variability within the other 7 properties that are there. I would basically call each one of these their own exposure unit. You could mention if you feel confident that, let's say, children from the property next door or wherever can also play and have the same kind of exposures as the children or adults in that property where you actually have data, could have the same kind of exposures, then you certainly can say that they would be exposed to those if indeed they are exposed from these other properties onto these ones where we have data for. So I would not extrapolate from the 3 samples to the other 7 where we don't have data.
If I may, I agree with that. You have to be cautious because your representativeness is only what you can sample, right? So it's like if you do an epidemiological study and an entire part of your community just doesn't answer, you can't really extrapolate to to what you're outside your sampling frame. That said, if you could sort of take a minimalist view on this. If your level of concern is greater than or less than 450, and you are willing to assume that there's 0 contamination in your other properties, then you know for sure that your average level is going to be at least 450 based on the 3 properties that you do have. So that could justify some action in of itself. It certainly could be higher, but at minimum, it would have to be at least 450. And that would be sort of the limit of what I could do with the data in of itself.
Thank you. Move on to the next question from Alexandra. Her question is, where can we find more information on composite samples for biota? Greg?
Yeah, sure. So we have a little bit more information within this guidance itself. And that was informed by our new SME, Lori Verbrugge from Region 10 in Alaska. She is the biota SME, and she helped us to put together those recommendations and the small section that's in this guidance. However, she is in the process of developing a larger guidance for fish and shellfish that will then be helped to inform updates to our FAST program where you can evaluate fish and shellfish better. But for now, we're using these specific general guidelines for using composite sampling with biota. If you have specific questions on your site, Lori would be, I'm sure, glad to help you with those questions.
Thank you, Greg. We have 3 minutes, so we can open up the line for one more question since we have a hard stop at 1 o'clock. So if you want to ask a question, raise your hand and we can unmute you. Or any follow up with the topic that we've already discussed, feel free.
It looks like we have a hand up. I can try to unmute.
Sure, thanks,
Person.
Jack.
Okay, Paul, you should be able to unmute and ask your question.
Thanks. Couple of issues or comments from the peanut gallery. With regards to what Arthur's question was about the 3 different concentrations, a lot of that's going to depend on where the properties are located within the 10 similar properties, and also with respect to the distance from the source. Obviously, the closer you are to the source from thermodynamics, you're going to have higher concentrations, and then it begins to tail off the further away you go. Unless you're talking about air dispersion, and then it's going to really depend on what sector you're in with regards to wind direction, rain out, and washout of the particulates in the air. So that's something else you're going to have to look at when you're looking at especially a larger site, more than several 100-acre site. Luckily, the ones I deal with are several 100 miles in square miles, so it's a little bit easier to address. The second comment is with, I forgot what it was. With Jim and his electron microscopy. That's a good point, because we've seen similar work, similar issues looking at radiological metals, which most radiologicals are metals. Occasionally you'll have a microscopic fleck of material that throws your numbers way off. And at least with the radiological part, no amount of milling, grinding, or anything else will give you a uniform distribution of that fleck of material, especially if it's a metal. So that's something you really have to be careful of. At least with the radiological part, if you, depending on how you count it, you can determine if it's a fleck based on what's called the coincidence counting with 2 different detectors, two identical detectors mounted in parallel. But it is a good point that if you have very, very small flecks of material, you'll never be able to get a good uniform analysis of the sample. And then also, depending on how the contamination got onto the site, whether it's in soil or what, if it was a flood, you may have more uniform contamination than if it was just dumped from a barrel or a truck or something. So there's a lot of history that you really have to look into the site to see how the contamination got there.
Yep.
That's all I've got.
I think those are all great points, and yeah, that's a good point about the radiological and the fact that a single particulate getting in and out of a sample can make a difference. The idea behind milling is that you sort of break up and disaggregate the material, so you get more particulates for a given sample mass that you're looking at. So it makes the effects of the Poisson distribution of that particle falling in or out of your sample a little less likely.
Yeah, we were trying to deal with some plutonium from a missile fire up at a military base, and no amount of work we could get could we get a uniform count. And the Air Force milled and milled and milled, and then they had a soil sample, they would count it, and then they would flip it around 180 degrees, and all the counts would show up on the other side and nothing on one side. So anyway, it was just a real pain. And then it showed up again at a DOE site in California where 3 different analyses by 3 different labs showed the same data distribution of a microscopic speck of something that threw all the data off.
Yep. That makes sense. And yeah,
Thank-
I know we're running
thank
out of
you.
time. I could talk about this all day. So,
Yeah, thank you, Paul, for the great comments. Yeah, our time is up. We're 2 minutes over. So thank you all for coming. We thank our panelists for presenting on a very important guidance. And for any questions, feel free to reach out any one of us individually. And we hope to see you in our next webinar. Thank you. Have a good rest of the day.
bye now.
Thank you.
Bye.